Vaccines are so important for our pediatric population because we want to protect these young children from really serious diseases before they are exposed to them. So some of these diseases include hepatitis B, polio, measles, mumps, among so many others. And so protecting them before they're exposed is really, really important because they can cause really severe disease and unfortunately sometimes even death. And so how I think about it for my own children, I can't protect them from everything in this world, but I can protect them from these really serious diseases. And so I'm going to do that.
Pediatric immunizations are also very safe and effective. Most are 90+% effective at preventing, if not entirely the disease, at very least severe illness from all of the diseases that we want to protect our children from, the ones that can cause long-term health effects and or serious death and disability. The most common side effects to pediatric vaccines are the ones that we all know and remember, the ones you get yourself. Of course, you get a fever, sometimes, especially children. They'll get maybe a sore arm, maybe a little bit of rash or swelling around the area of the site of injection. But for the most part, they're very mild. They last a day or two, and they'll go away in short order. You can treat them with ibuprofen, Tylenol, and the kids do quite well. The thing I usually tell parents is that of course there's side effects. All medicines that work, that do something, there's possibility for side effects. And vaccines work really well. And what they're doing is they're making your immune system work. So of course you're gonna have something happen, but what happens is minimal and mild, and the chances of having any long-term issues from it is incredibly low as compared to the risk of actually having one of these infections that we vaccinate for, where the morbidity and mortality, as in the chance that something really bad could happen, is significantly higher.
A lot of times the way that vaccines work is we provide an antigen to the patient that then produces a cascade and allows the body to make antibodies which will recognize the disease if the kid or anybody is exposed to it that's been vaccinated. There are other types where we actually give antibodies as well, but in the end, the goal is that when we are exposed to the virus or bacteria, your body recognizes it and it can either prevent it from you even getting sick or maybe even reduce some of the way you feel if you were to contract the disease.
The thing that we know, and that's reassuring, is that a child their immune system can handle this. From the moment that they are born, they are exposed to millions, if not billions, of different bacteria, and that colonizes their skin and their body. They're exposed to viruses as well. And so the one vaccine is just like a raindrop in an ocean of their immune system.
And spacing out vaccines is a common question I often get asked in primary care too, and ultimately it comes down to the parents' comfort level. I obviously enjoy partaking in shared decision making with the parents, what they're most comfortable with. There really is no specific data or research to support spacing out vaccines, and I really strongly advise against it, only because there are certain vaccines that are meant at certain stages of growth for a child in their development that it's really important that we get the vaccines there on time.
So there are so many vaccines because we have to protect against 14 or more diseases. And so in the span of 2 years, a child can get up to 25 different vaccines at a given time because some of these diseases require multiple doses, some boosters to fully protect the child and give them that immunity. So some parents wonder if they're going to be really stressed with 4 vaccines at once. So studies have shown that cortisol, it's a stress response, that goes up whenever we have an event or a vaccine. And so they looked at this cortisol level when the children got 1 vaccine, 2 vaccines, all the way up to multiple vaccines, and their response was the same. And so instead of not giving all at once and spreading them out, it is much better to give the child all the vaccines at once. They're going to have that stress response, and then you're not going to continue to have that.
This is, one of the most common questions I think I face in my clinic with many of my patients. This whole topic, this issue came about in 1998 when there was an article that tried to link these two things, the vaccine with children who then developed autism. And that sparked an incredibly large amount of research that has gone on over the past few decades. There have been 18 different studies done all over the world to try to correlate that connection between MMR, vaccine, and autism. And there's been no connection made. There is no medical evidence that autism is a result of the MMR vaccine. I think that the reality is that the diagnosis of autism tends to come into focus for healthcare providers all around the same ages and times that we're giving some of these vaccines.
Hepatitis B is an infection that affects the liver, and in the world it's one of the most common liver infections, and the problem is that it can progress to liver cancer left untreated. So the reason that we immunize is because people are very mobile, and now the risk of exposure has increased over time. So we've probably been doing hepatitis B immunization for babies, well, I know, for over 30 years, because our oldest is 30, and he received that when he was an infant. All healthcare workers have to be immunized, and we always recommend that teachers are immunized as well, because it's whoever's exposed to body fluids, potentially blood, like through bites, that can give you an infection of hepatitis B. So 3 immunizations helps prevent, for usually about 10 years, your immunity stays pretty good. And then if you need to, people can have that immunity checked and then have a booster shot. HPV stands for human papillomavirus. It's a wart virus, and it can cause not only growths, like a wart that's a little different one that you get on your finger, or a plantar's wart, but it causes usually genital warts. And we know that the majority of cervical cancers and penile cancers are from HPV, are caused by that. So right now we have an immunization that can help prevent cancer in your child later on in life. And the best time to be immunized is early on, before there's exposure. There's a good study just out of Sweden that they looked at over 1 million women, and comparison between immunized and not immunized, 90% decrease in cervical cancer with the women that were immunized. It's always hard to immunize against a disease that you're not sure that your child is at risk at. So it's not like chickenpox, right, where pretty much everybody gets it. But again, it's your one opportunity to help prevent your child from getting a cancer.